The vascular anatomy of the kidney is characterized by a precise segmental arrangement that is critical for surgical interventions, particularly in partial nephrectomy and transplant surgery. Arterial supply. The renal arteries typically arise from the abdominal aorta at the level of the L1-L2 intervertebral disc. Main renal artery. Before entering the renal parenchyma, the main artery usually divides into anterior division, supplies the majority of the kidney, apical, upper, middle, and lower segments. Posterior division, crosses the superior border of the renal pelvis to supply the posterior segment. Segmental arteries. These are functional end arteries, meaning there is no significant collateral circulation between segments. Obstruction or ligation leads to segmental infarction. Lobar and interlobar arteries. Arising from the segmentals, interlobar arteries travel between the renal pyramids. Arcuate arteries. These arch over the bases of the renal pyramids at the corticomedullary junction. Interlobular arteries, cortical radiate, extend into the cortex to give rise to the afferent arterioles. Brodell's line. A key surgical landmark, Brodell's line, or the avascular plane, is located on the posterolateral border of the kidney. It represents the interface between the territory of the anterior and posterior divisions of the renal artery. Incising through this plane minimizes blood loss during nephrolithotomy or parenchymal surgery. Venous drainage. Unlike the arterial system, the renal venous system is highly collateralized. Interstellar stellate veins drain the superficial cortex. Arcuate and interlobar veins follow the paths of the corresponding arteries. Renal veins. The left renal vein is significantly longer, approximately 6 to 10 centimeters than the right, crossing anterior to the aorta. It receives the left gonadal, left adrenal, and left ascending lumbar veins, a critical fact for mobilizing the vein during a left donor nephrectomy.